Hello everyone, I'm TonNicolai. I'm Secretary General of EUROCAM. I'm a medical doctor. Initially I worked as a general practitioner, then I studied several modalities in the field of complementary medicine, and afterwards I worked as a homeopathic consultant for many years. I'm very pleased with the growth of integrative medicine. I believe it is an excellent way to integrate conventional and complementary medicine, which is in the interest of both patients and health professionals working in the sector of complementary medicine. It is therefore an honor for me to have been given the opportunity to speak at this Congress on integrative medicine. It's a pity I can't see you, I can't hear you due to this pandemic, but somehow we'll manage. The theme of my presentation is putting integrative medicine on the agenda of the European Union institutions and the role EUROCAM is playing. So let's start with what EUROCAM actually is. EUROCAM unites European umbrella organizations representing patients using CAM and trained CAM health professionals, including medical doctors, vets, and other practitioners. And through the umbrella organizations, EUROCAM represents about 60,000 organized patients, around 250 national CAM associations, which means a substantial part of the 400,000 healthcare professionals in the CAM sector across Europe. As far as our affiliated organizations are concerned, they represent health professionals who practice CAM modalities that have a research tradition. So represented modalities are, for instance, I have listed them here: acupuncture, anthroposophic medicine, Ayurvedic medicine, herbal medicine, homeopathy, osteopathy, and traditional medicine. This is a picture of one of our meetings in Brussels. You can see that there is a very cooperative and collaborative atmosphere. We are very happy to be together and to work with EUROCAM. The statutes stipulate several aims and objectives. I will show you some of them here: promoting the contribution of CAM to sustainable patient-centered healthcare, promoting, facilitating CAM's role in maintaining citizens' health, highlighting the health promotion and illness prevention aspects of CAM, and advancing the accessibility, affordability, and availability of CAM. I would like to proceed with the outcome of the Cambrella network. The Cambrella network was a network of researchers that conducted a research program into the situation of CAM in Europe. It was funded by the European Commission several years ago, and its task was to assess the situation of CAM in Europe and to come forward with some recommendations as to the place within the EU healthcare system. And you can see here some of the broad conclusions. CAM is in fact a part of healthcare, although not officially, but it is. There is a high demand and widespread use of CAM by European citizens, a considerable number of healthcare professionals in the sector, a lack of integration of CAM into national health systems, and inadequate research facilities are available to CAM. They published several reports, as you can see, on terminology, legal status and regulation of CAM, citizens' needs and attitudes, the use and provision of CAM in Europe, the view of global stakeholders on CAM research, and a general roadmap for future European CAM research. All these reports are still available. You can download them from the EUROCAM website. As you all know, CAM is a societal phenomenon in the whole Western world, and with a strong increase over the last 2 decades. And Cambrella made an overview of all studies on the demand for CAM among citizens in Europe. And they came to the conclusion that 1 out of every 2 citizens in Europe use CAM, either by seeing a CAM professional or by using over-the-counter medicinal products. But in people with chronic conditions, this number is much higher. It's up to 90% even. What are the reasons, the motivations for citizens to use CAM? That was also a subject of their study. It is about increasing personal responsibility for one's own health, a preference for a more holistic view on health and healing that goes beyond managing symptoms, a preference for more gentle, more natural therapies, and dissatisfaction with conventional medicine because of its unpleasant side effects, but also because the treatment for their particular condition turned out to be ineffective. And another concern is their long-term drug regimens. If we look at the CAM profession in Europe, we can see that there are around 150,000 medical doctors with an additional qualification in one of the CAM modalities. They are also called dual-trained medical doctors, or in more modern terminology, you could say that they are integrative medicine doctors. And in Germany alone, there are 60,000 of them. The CAM modalities mostly provided by medical doctors are acupuncture, homeopathy, naturopathy, anthroposophic medicine, and neurotherapy. In addition to medical doctors, there are over 180,000 CAM practitioners without a full medical education. Could be even more than 200,000. It is not really known. And they practice mainly acupuncture, chiropractic, osteopathy, herbalism,